Prediabetes Warning Signs and Reversal Guide. Hello, and welcome to Pharmacon Health. Today we tackle a condition silently affecting 1 in 3 adults, prediabetes. This is the critical stage where blood sugar is elevated but hasn't reached a type 2 diabetes threshold. It's a golden window for prevention if ignored. It leads to serious complications. The good news, prediabetes is super reversible, seriously, is not a dead end. We're going to dive into the science behind it, highlight the 7 key warning signs you really should watch out for, and lay out a simple step-by-step plan so you can start making changes today. Prediabetes is diagnosed via the hemoglobin A1C test, which falls in the 5.7% to 6.4% range. This is your average blood sugar over the last 3 months. This happens due to the main reasons. 1. Insulin resistance. Even though insulin arrives, the body's cells stop unlocking their doors to let glucose in for energy. 2. Beta cell dysfunction. Your pancreas initially overproduces insulin, but over time, it wears out, paving the way for full-blown type 2 diabetes. Being over 45, having excess abdominal fat, a sedentary lifestyle, and family history are primary risk factors. Now that we understand this, let's move to the main event, the 7 silent warning signs we often ignore. Sign 1. Excessive thirst, polydipsia, and frequent urination, polyuria. This is direct evidence that your blood sugar regulation is failing. The mechanism: when your blood is saturated with sugar, the kidneys work harder to filter it. The sugar pulls excessive water out of the body, a process called osmotic diuresis. Action step: consult your doctor immediately if you experience frequent urination, especially at night. Sign 2. Unexplained fatigue and low energy. Do you feel tired all the time, even after a full night's sleep? The mechanism: insulin resistance prevents your cells from using glucose. The fatigue is not a lack of energy, but a lack of energy delivery. Your cells are starved of fuel. Action step: pairing protein, fiber, and healthy fat with every meal prevents rapid blood sugar spikes, minimizing the energy crash that follows. Sign 3. Unexplained weight gain, especially abdominal fat. This is a sign of metabolic failure where insulin acts as a fat storage hormone. The mechanism: excess insulin is a potent fat storage hormone. Visceral fat releases inflammatory cytokines, which worsen insulin resistance. Action step: track your waist circumference, aiming to keep it under 35 inches for women and 40 inches for men. Focus on losing just 5% of your body weight. Sign 4. Blurred vision or frequent changes in vision prescription. This ocular symptom is often misdiagnosed because it can be temporary. The mechanism: high glucose causes a rapid shift in the fluid content within the eye's lens, distorting its shape. Action step: get an eye exam that checks for early signs of long-term damage such as retinopathy. Now for the final 3 signs. These are the most physically visible, and often the most serious. Sign 5. Slow healing of cuts, scrapes, and wounds. If a small cut takes weeks to heal, your body's repair mechanism is compromised. The mechanism: high sugar damages blood vessels, blocking oxygen and nutrients from reaching the wound site. Action step: practice extreme caution. If you have a wound, keep it clean. Sign 6. Tingling or numbness in the feet or hands. This is early neuropathy. It is one of the most serious physical warning signs. The mechanism: high sugar damages the tiny blood vessels that supply the nerves. Action step: inspect your feet daily and request a nerve test from your doctor. Sign 7. Darkened skin patches called acanthosis nigricans. This visible sign is a dermatological manifestation of metabolic trouble. The mechanism: excess insulin acts on the skin cells in areas like your neck, armpits, and groin, forcing them to multiply rapidly. Action step: treat this as a metabolic emergency signal and get immediate blood sugar testing. Why is prediabetes dangerous? The damage to your blood vessels, kidneys, and nerves begins even before your blood sugar hits the full diabetes range. Heart disease: prediabetes is an independent risk factor for heart attack and stroke. High glucose damages arteries and accelerates the formation of fatty plaque. Kidney disease. Your kidneys are damaged by constantly filtering excess sugar. The earliest sign is leakage of small amounts of protein into the urine called microalbuminuria. Prediabetes is not just a little high sugar, it is evidence that your body can no longer handle metabolic stress. Especially if you also have high blood pressure and abnormal cholesterol, your cardiovascular system is at high risk. Now, let's move to the section where we hold the power to reverse these dangers. The first step to reversal is knowledge. Ask your doctor for the fasting plasma glucose and hemoglobin A1c HbA1c test. The HbA1c test measures your average blood sugar level over the last 2 to 3 months. This shows long-term metabolic health. Home monitoring. Continuous glucose monitors and glucometers help you become your own health detective. Tracking. Keep a detailed log of every meal and activity to understand exactly how foods, stress, and sleep affect your glucose response. For example, rice might cause a huge spike for you, but chickpeas might have minimal impact. Ask your doctor to retest your HbA1c every 3 to 6 months. Now for the actionable plan. The Diabetes Prevention Program study showed 3 main pillars that reduced risk by 58%. Pillar 1. Nutrition. The goal is to eliminate rapid glucose spikes that force your pancreas to overwork. Prioritize fiber. Fiber in foods like oats and legumes slows sugar absorption. Reduce refined carbohydrates. Meal combining. Never eat carbohydrates alone. Always pair them with protein or healthy fat to lower the glycemic load. Pillar 2. Exercise. Exercise improves insulin sensitivity faster than almost any medication. Mechanism. When your muscles move, they use glucose directly from the blood without needing insulin. Commit to 150 minutes weekly of moderate activity and include resistance training to build muscle mass. Action tip. Walk for 10 minutes after every meal to prevent high post-meal glucose surges. Pillar 3. Sleep and stress management. These are the most overlooked metabolic disruptors. Chronic stress elevates cortisol, which instructs your liver to release more glucose into the bloodstream. Sleep. Getting less than 7 to 9 hours of quality sleep worsens insulin sensitivity overnight. Action step. Dedicate 15 minutes a day to breathing exercises or meditation. Avoid blue light before bedtime. Beyond the pillars, there is one number that is a game changer. Losing just 5 to 10% of your body weight drastically improves insulin sensitivity. This is because it specifically targets visceral fat, the most metabolically harmful fat. Losing it reduces inflammatory cytokines. Action step. Focus on consistent and sustainable progress, not rapid weight loss. You now know the foundational pillars of reversal. Let's move to the advanced techniques that turbocharge insulin sensitivity. Tactic 1. Apple cider vinegar. 1 tablespoon before a carbohydrate-heavy meal can reduce the post-meal glucose spike by up to 20%. The acid in vinegar slows gastric emptying, delaying how quickly glucose is absorbed. Tactic 2. Meal ordering. Eat fiber and protein before carbohydrates. Fiber and protein coat the intestine, slowing how fast carbs enter the bloodstream. Tactic 3. Optimize exercise timing. Movement after meals has unique advantage. A 10 to 15 minute walk immediately after eating forces glucose into the muscles quickly. You can further improve insulin sensitivity by increasing total weekly physical activity to 200 minutes. Now let's bring it all together. This is your 4-step daily action plan. 1. Combine meals. Always pair protein and fiber with carbohydrates. 2. Incorporate movement. Walk 10 minutes after meals. 3. Track HbA1c. Get tested every 3 to 6 months. 4. Lose weight. Target losing 5% of your body weight. A prediabetes diagnosis is a chance for a new beginning. It is the opportunity to reclaim your health. By improving insulin sensitivity, you are protecting yourself from heart disease, Alzheimer's, and other metabolic disorders. Thank you for taking the time to absorb this vital information. Knowledge, when converted to action, is the biggest tool in prevention. If you found this information valuable, please like and subscribe. Share your health journey in the comments. Thank you once again, and best wishes on your health journey.